Up. My name is Dr. Arnold Pike, and this is Viewpoint on Nutrition. Hello, I'm Dr. Arnold Pike, Director of the Academy of Nutritional Sciences, and this is the Nutrition Connection to tuning up your body. How can you do it? Well, one who knows is Dr. Alpan. He's written a new book called The Tune-Up Manual for Humans. The Tune-Up Manual for Humans. Let's find out from Dr. Alpan right now, who is the book intended for, Doctor?
Well, the book is intended for the very young, the very old, men or women, of every race, religion, healthy people, sick people, newlyweds, especially who are planning to have children, breastfeeding mothers and their babies, the weaning baby, especially the age group of 20 to 40. This is the time of life when the abuses of the earlier years starts to show up, and the individual starts to see early signs of changes that he doesn't like, and he complains about, goes to his doctor and so on. It's for the vegetarian, it's for the fruitarian, it's for anybody that eats animal protein, it's for the athlete. The book is also for the executive. It has something for just about everybody in every walk of life. It is also for the person that has read many books on nutrition and is now so confused by all the conflicting authors' opinions of what should and shouldn't be done. It is also for the person who has never read a book on nutrition and wants a source and a guide to the right books to read and a technology that has been proven clinically to work on humans over the last 16 years. It is for the 8 out of 10 people who have a musculoskeletal dysfunction or temporomandibular joint problem. That is, that their bite is off. It is for 80% of the adults in the country who have bone loss around their teeth, which is osteoporosis. And this is a sign of bone loss in the rest of the body. It's for 98% of the people with mercury fillings, and for 80% of the adults with tartar, arthritis, kidney stones, gallstones, cataracts, and arteriosclerosis.
Dr. Alpan, it sounds that your Tune-Up Manual for Humans is intended for everyone, really. Well, looking through the book here, it's quite comprehensive and has some exciting new technology in it. What are some of the sources of this new technology, Dr. Alpan?
Well, it goes back to Hippocrates. Basically, as he said, that we should do nothing that will harm the patient. And so this technology is designed to do just that, to only help the patient with no harmful side effects. Then from Hippocrates we come into our more current era, present time, and we look at Dr. Weston Price's work. In his book, Nutrition and Physical Degeneration, he discusses his early discoveries of primitive peoples in the early part of this century and how they didn't have the degenerative diseases that we have today. Then, of course, in Melvin Page's work in endocrinology and the calcium phosphorus ratio. Then there's the work of Dr. Shelton, Herbert Shelton, in food combining, and Broda Barnes, and John Diamond's kinesiology. All of these things are incorporated in this technology. And of course, Emmanuel Cheraskin's Diet and Disease is where it all started for me when I realized that one's diet does affect one's health. And then there's Pottinger's cat experiments to show how diet affects the skeletal structures. And then there's Bernard Jenkelson's technology on muscle-skeletal dysfunction and TMJ therapy. And of course there's Dr. Henry Buehler's book and his work in Food is Your Best Medicine. And then Dr. Aval's Toxicity and Mercury Fillings in the Mouth, and the electrogalvanic currents and the effects of different fillings in the mouth and how that affects the body. And more recently in this year, Dr. Sam Ziff wrote a book, The Toxic Time Bomb, which explains the mercury toxicity and how mercury affects the whole body. And then we incorporate in this and integration in this technology, Carrie Ream's pH balance, and also John Ott's work in light radiation and things like that. So all of these things over the last thousands of years, and mostly emphasizing current discoveries in the nutritional sciences, we have integrated all of these technologies in the tune-up manual. So the sum is greater than all of its parts in this case.
Well, I know it took many years of your own research working on this, putting this tune-up manual together. Now, I know about the technologies that my dear old friend Dr. Herbert Shelton, Dr. Sharasan have advanced, but how, Dr. Alpan, have you been able to put these technologies into your own practice in Los Angeles?
Well, basically, what we've done is, in developing this technology over the last 16 years and proving that it works in clinical experience, what we've done is we've developed forms, first of all, for the individual to fill out. And these forms are in the tune-up manual. The forms then give the individual an opportunity to find out what their condition, their present condition is, and whether or not they need the tune-up. We do the necessary x-rays. We do a physical examination of the individual. And then, of course, we do a very thorough diagnosis and a treatment plan. And the patient is given home care instructions on how to take care of themselves, not only with oral hygiene and oral health, but also the general health of the entire body and nutritional advice. We do the gum treatments, then remove all the decay from the mouth to get rid of any bacterial problems. We replace the mercury in the mouth. Then we go on to do a bite analysis in order to determine the relationship of the lower jaw to the upper jaw and its effect on the brain, which then affects the whole body. We would then go on to make an appliance that would then correct this incorrect bite, and then do 3 months of therapy, followed by nutrition electroacupressure tests to determine specific nutritional requirements. And then we would do a muscle test to check which nutrient supplements should be given. Then we would do the anthropometric measurements, which is the measurements of the arms and legs developed by Dr. Page 50 years ago to determine hormonal imbalances. Then we do the hair analysis, blood tests. Then we give the patient the tune-up diet. And with this, we then go into specific glandular supplements, do a blood test series, and then finally the tune-up is complete.
Well, I know I've been one of your patients, Dr. Alpan, and you were very successful in taking care of my problems, but overall, how successful have you been in using this technology in your own practice?
Very successful. The very nice thing about this is for the last 7 years, we've even been doing this by mail. So people from all over the world have had this test done, people that we've never even seen at the Dental Health Center in Los Angeles. The results come from over 2,000 patients with over 25,000 blood tests. What we have done is we have seen on these 2,000 patients that we can actually normalize such things as the blood sugar, triglycerides, the calcium to phosphorus ratio, cholesterol levels normalized, hemoglobin raised to normal levels, uric acid levels brought to normal, and white blood count normalized. Also, the pulse, the weight, the underarm temperature, and blood pressure has been normalized as a result of the tune-up. We have seen that the immune system has been strengthened by removing mercury toxic fillings from the mouth, by giving the patients proper nutritional support. We have seen the improvement of blood and lymphatic circulation through aerobic exercise and other things that we do. We've normalized the urine excretion, normalized bowel movements from 1 to 3 times per day. It improves the function of every cell in the body. We have seen that it enhances the cardiopulmonary function so that a person's pulse rate and heart rate comes down. And we have seen the restoration of the function of digestion, absorption, assimilation, and elimination. We have also, with this technology, replaced the deficiencies of vitamins, minerals, digestive enzymes, and hormones. And as a result of this, the other results that we have seen besides stopping tooth decay and bone loss are things like psoriasis has been eliminated, migraine headaches, when people could not get any relief from any other source. we have seen these symptoms disappear. Body aches and pains, loose teeth, tooth sensitivity, bleeding gums, arthritis, high blood pressure has been brought down to normal. All kinds of skin problems, dizziness, backaches. I can go on and on. There's 61 signs and symptoms of disease that we have seen actually eliminated by this process. And these are all discussed in the tune-up manual. There are many success stories from people on these different conditions.
Dr. Alpan, what is most unusual about this whole report here, you are one of the leaders, of course, in preventive dentistry, and we think of the dentist usually as one who handles the problems of the mouth. How did you happen to come in possession of this most unique technology regarding health?
Well, it started out in 1970 when I attended a lecture by Dr. Emanuel Cheraskin. And there I learned from Dr. Cheraskin's studies on 800 dentists and their wives the connection between diet and disease. And that's when I got involved with this whole process. And at that point, in that year, my daughter was also born. So I had a very personal reason for seeing to it that my daughter's future health during the rest of her lifetime would be better than mine, because my wife and I had tooth decay when we were growing up. We had all kinds of problems in our mouth, and I didn't want this for my child. So after I attended this presentation, I then started delving into it and discovered many more things. Found out that, for instance, that 40% of the fillings that we do in dentistry is under old fillings. So that means that even though we remove the decay when we put fillings in teeth, that doesn't stop the tooth from decaying. I found that brushing and flossing really doesn't stop tooth decay. In fact, the only reason to brush and floss is to keep the gums healthy. I also discovered that fluoride was really not a good way to stop tooth decay because it has other harmful side effects. And so one discovery led to another. Then I found out about PAGE, and that, of course, was the real cure for tooth decay and bone loss. And then as a result of doing the tune-up, we found that it affected the whole body. And I found that I could make a living helping others prevent disease as well as just treating the disease. It was also much more emotionally rewarding for me to do this kind of practice than just doing the normal drilling and filling things that a dentist does. And I was convinced that what I was doing was essential for the survival of man on planet Earth, because I found, and it is expressed in the tune-up manual for humans, that what the technology here is really a technology for survival for man on Earth.
Jack, you talk, of course, about tuning up, but how does one know if his body is out of balance and needs a tune-up?
Well, the first thing that the reader of the tune-up manual for humans will discover is that there are forms in the book. And if the reader will fill out these forms, answer the questions, and find out the early signs and symptoms of disease, if they apply to them, then that person is definitely out of balance. For instance, and also if traditional treatments do not work when they go to their physician or dentist, and it doesn't seem as though whatever is being done in traditional sense, it's not really solving their problem, then this is a sign that they are out of balance and need the tune-up. Also, they notice that their symptoms are only masked by drugs, and then the symptoms come back. And more symptoms occur over a period of time. Fatigue is one of the early signs that there is a problem. Chronic colds, caries, bleeding gums, bone loss around teeth, all of these are indications that the person's body chemistry is out of balance. Of course, the desire for drugs such as coffee, tea, sugar, cigarettes, alcohol, and then later even stronger drugs are clues that the body is out of balance and in trouble. And of course, if there's a spiritual